Hello and welcome to Philadelphia Urology Associates. I'm Dr. Bruce Sloane and I'll be performing a vasectomy. So let's talk about a vasectomy. First of all, it is an excellent form of birth control. It's minimally invasive, takes a small amount of time, and preserves your sexual function completely, except for one imperceptible thing. We'll talk about that. So the first thing is that vasectomy is one of the most effective forms of birth control that are available. And interestingly enough, it's underutilized because a lot of men either don't do it or don't know about it. So it takes place in the office under local anesthesia. I always give my patients a 0.5 milligram of Xanax to take 1 hour before the vasectomy as it calms people down. People tend to be anxious when they come for the vasectomy. Please don't feel obligated to use the Xanax if for some reason you don't feel comfortable doing that. I appreciate if you could shave the scrotal hair 24 to 48 hours prior to coming for your vasectomy. Don't take any aspirin or ibuprofen 1 week before the vasectomy for bleeding reasons. If you need something for pain, you're welcome to use some Tylenol. Now, on the day of your vasectomy, you'll wake up, have a light breakfast or a light lunch. I don't consider this a surgical procedure. Ideally, have somebody drive you to the office. You'll arrive, you'll lie on a table. I'll apply the local anesthesia and make a very small opening at the top of the scrotum. At that point, I'll find the two little tubes, which are known as the vasa deferentia or vas. I will divide them with an electrocautery tool. I'll place clips on them and put them back in the scrotum. There are no stitches. You'll have a bandage over the small area. Put on some either tight underwear, jockstrap, or anything that you got from Amazon to keep the testicles up and supported, and go home. Once you're home, sit on your bed or your couch. Please put an ice pack over your underwear, pants, jockstrap, whatever you're wearing, until you go to bed. That will keep the swelling down. Any pain, use some Tylenol, Motrin, ibuprofen. You can use any of those after the vasectomy. Go to sleep. When you wake up, take off the bandage. You may shower, hang around the house. I recommend you do not drive for 24 hours. Don't do any heavy lifting, strain, or exercise or of any form of sexual activity, specifically in ejaculation, for 1 week. Now, as you probably know, the vasectomy takes about 3 months to kick in. So whatever birth control you're using, you must use that until we've documented that you have 0 sperm. How do we do that? There's 2 ways. You could either purchase a kit, which is very convenient. The kits run about $149. You can submit that to your insurance company. You'll get part of that back for reimbursement, probably not the whole thing. The nice thing about the kit is you can produce the specimen from home. You could mail it and you'll get an email about the report as soon as that's available. Most men have 0 sperm count at 3 months. On occasion, and this does happen, some men take up to 6 months, so you may have to have some patience. Now, the other way to do your semen analysis, we'll give you a cup after the vasectomy. Bring your cup with your semen in 3 months, we'll send it off for you. Doesn't matter which way you do it. I find the kits to be most convenient, but do not feel obligated. Once you're 0, what I say shooting blanks, you are good to go. No need for birth control or anything else. Now, there's 4 possible side effects that I'd like to tell you about. You should know that they rarely happen. We're talking about 1 or 2% of the time, but they do happen. So let's talk about them. Side effect number 1, we keep checking your sperm. 3 months go by, you're not shooting blanks. 6 months go by, you're not shooting blanks. That means that the vasectomy did not work. And yes, there is something known as a vasectomy failure. And if that's the case, we have to do the vasectomy over again. In terms of real numbers, I've been doing vasectomies for about 32 years. I've had to do that 6 times in my career. Now, there may be other men that have had that problem that I don't know about, but mostly it's a very small percentage of men. Side effect number 2, we do the vasectomy. You're shooting blanks. Great, everything worked. You stop using birth control, and a year later, your partner gets pregnant. Well, how does that happen? Well, this is a condition known as recanalization. In plain English, the tubes went back together again. Yes, it happens. Yes, it's a known side effect, and it is quite rare. But you should know that nothing is 100% guaranteed. If you're using condoms, they can break. A woman having a tubal ligation can get pregnant. Same thing. But overall, this is a highly effective form of birth control. You just need to know about that particular side effect. Side effect number 3 is known as a hematoma, or a blood clot in the scrotum. Why would you get a blood clot in your scrotum? Basically 2 reasons. One, either you were bleeding at the time of the vasectomy, I did not see that, and I sent you home, and you woke up the next morning, and you had a scrotum the size of a grapefruit. Reason number 2. On your way home, you decided you felt so great, you were going to go for a mountain bike ride, motorcycle ride, lift weights, or play basketball. Now, I know you're probably not going to do that, but if you did, that's a good way to get a hematoma. And again, quite rare. I rarely see these, but you need to know about them. The final and 4th side effect is the most uncommon of all. And to be very honest with you, I've never seen it, but it does happen. If you Google it, you'll find it. And it happens in less than 1% of all men. And it's called the post-vasectomy pain syndrome, which is exactly what it sounds like. I do the vasectomy, and I do the same technique on all the men. You call me 2 weeks later, and you say, hey, Dr. Sloane, it's me, Dr. S. You did my vasectomy 2 weeks ago. I'm kind of having some discomfort and pain in my testicles. And I say, oh, it's only been 2 weeks. Not to worry, you'll be fine. Thanks, Doc. You call me 2 weeks after that, which is now a month after. And you say, Doc, I'm not getting any better. And the problem is you don't. So this pain can go on for a long time, for months after, and it turns into a constant pain problem, which is known as the post-vasectomy pain syndrome. Now, that's usually able to be managed with medications such as Motrin, ibuprofen, Aleve, etc. And in the worst case scenario, you'd have to reverse the vasectomy, which almost always cures the problem. Now, I've never seen that. I've never had to do it, but you should know that it exists as a potential side effect / complication. But overall, 99% of the time I do vasectomies, I never see the men again. A couple of other things you should know. You will have my cell phone number. If you have any problems after your vasectomy, whether or not it's a week or a month or 2, you can call me, no problem. Second thing to know is the experience of sex will be exactly the same for you. What do I mean by that? Your ejaculations will be normal. Your erections will be normal. Your sensation will be normal. The only difference is you will be shooting blanks. That's the vasectomy. If you have any other problems, please ask me in the office. Thank you, and I'm looking forward to seeing you on your vasectomy date.